Hello everyone, and welcome to our webinar on opportunities in purchase services post-COVID. My name is Mickey Meehan and I'm the Chief Customer Officer at Conductive. I've been here for almost 4 years now, running product management, marketing, customer success, and our software development teams. You may notice this is a new name for us at Conductive. Formerly we were known as MedPricer. We recently rebranded to Conductive and also added a purchase services GPO to our total offering. Today we're going to talk about the role of purchase services through COVID-19, the renewed importance of hospital-supplier relationships given that environment, 4 guiding principles for the future of purchase services, and then we're going to talk for a minute about the momentum of purchase services programs, and we're going to reflect on what we talked about today and how we move forward. So what does the role of purchase services look like through COVID-19 and now as we get into the later stages in some parts of the country? And so, I don't think I have to spend much time on this. What did we all experience? Obviously, worldwide supply chain disruptions, emphasis on keeping businesses going amidst the COVID surge and the second wave that happened after the reopening of many areas, drastic cost reductions and goals related to lost revenue, reevaluating governance, and then really looking at supply chain has had an elevated focus. It's obviously was thrust into the spotlight given the shortages in PPE, but it gives all of us in supply chain the opportunity to really bring everything we do to the forefront. And so I think as we come out of COVID, we are looking to help our customers do that, and that is really important for all of us. So what is the overall opportunity in purchase services? And this is something that we've been talking about for a long time. But we find that purchase services accounts for somewhere between 15 and 30% of the operating spend of a health system. Oftentimes, it's difficult to measure and control. It's not often centralized. And in a previous webinar, we talked about the fact that we estimate that there's almost $39 billion of unexploited savings that's left on the table. We've been with customers when we come in where they haven't sourced their food and nutrition contract in 25 years, or where they're potentially paying services suppliers on recurring contracts for services that aren't even being used. So we've seen all these different scenarios, and so we want to make sure we bring that awareness that there is a lot of waste, and this can be a huge area for cost reduction to make up that gap in revenue that COVID has created. And I think a very important thing on top of this is that when you look at purchase services, when you take a hard look at it as an organization, it can offer savings directly to your bottom line immediately. There's no need to worry about reimbursement like in PPE and these other areas that often draw a lot of focus. Every dollar you save immediately drops to the bottom line in your operating margin. So that's just something to keep in mind. Outside of COVID, which is hurting revenue, what are some other factors that are creating this new reality? Revenue growth was already lower, right? We were already seeing lower reimbursement. We were seeing issues with payer mix, those kinds of things. Higher operating costs, right? We've seen the cost of labor itself go up, supplies go up, and now with the need for supply chain resiliency and likely domestic manufacturing, you're going to be willing and want to take price increases in certain areas in order to ensure that resiliency. So how do you make up for in other areas? The market consolidation has been huge. That's something that we've all witnessed, kind of the birth of some of these mega systems throughout the country. And that's, creating changes in the way that supply chain deals with purchase services. New business models, we saw ACOs and those types of things come into the market. Payers as providers, that's not necessarily a new thing, but it's definitely becoming more pervasive. New technologies, how is AI, machine learning, and really just big data coming into healthcare and making an impact? And then again, maybe even kind of pushed ahead due to COVID-19, telemedicine and other kind of new entrants. a bigger focus on non-acute care, and a bigger focus on maybe even standalone emergency rooms and things like that. So and is Walmart and Amazon going to come in and play in these markets? So all those things are coming together to say, what do I now need to do as a health system to make sure that cost efficiency and my supply chain can be a competitive advantage? And what systems, what technology will I adopt in order to make up for the fact that maybe I'm not staffed as heavy as I should be in supply chain? How do I better leverage my GPO, other GPOs to provide the kind of support to my supply chain department to make sure that I can adopt new technology and move forward? All this has given birth to the renewed importance of hospital-supplier relationships. And so this is something that, again, was already kind of coming to the forefront. We've all done QBRs with our suppliers, right? But there's a certain number of suppliers, your key partners, who you need to be engaged with on a day-to-day basis. And I think, as we had the PPE shortage and as you needed essential services provided in your hospital despite the environment, this really shone a light on who these suppliers are, and the fact that you probably needed a lot more closer to you, invested side by side to ensure that your patients have positive outcomes and that your health system can continue to move forward. And so we really saw suppliers as the unsung heroes in COVID in many cases, right? Oftentimes they came in with flexibility on terms and delivery in order to help with the crisis. They came up with new ways to provide their services potentially in order to meet the needs of the rules that our health systems and providers put in place. We saw processes change to quickly allow new suppliers who could help with certain services that may not have been needed prior to COVID-19, but definitely came into the forefront. And we saw suppliers and health systems and GPOs even collaborating to make that happen quickly. We also saw suppliers who were going out of their way to do things not their core in order to better help their health system or provider customers. Procuring products that weren't part of their normal set in order to make sure that their customers had everything they needed to be successful. And then, just like our frontline healthcare workers were extremely important and continue to be extremely important in delivering care right now at a risk, many suppliers were in the same boat. Going into the hospitals, going into the units themselves, and ensuring that everything that was needed was there and that all essential services continued to be delivered. I think what's important is that purchase services have proven to be critical to the financial and operating health of our healthcare organizations. And again, as we move forward here, that focus is going to become even more important as it shifts from delivering critical care to those patients, and now it's going to move to delivering critical financial outcomes for healthcare organizations. How can they stay alive given the revenue shortfalls that they've had over the past months? And how can they perhaps come out even stronger in order to be set up for future success? Now we're going to look at the 4 guiding principles for the future of purchase services. The first is that we need to identify the single source of truth. Now, this seems like it should be easy, but in reality is often the hardest part of really looking at putting in a purchase services program. You need to get your arms around your purchase services spend, and this is hard to do for a variety of reasons. Often, the spend has been controlled by end users. They're the ones who know what a particular supplier does, so supply chain doesn't have awareness of what their entire spend profile looks like. They don't know what they spend per category. And that's because you have disparate data sources. And that's because your purchase services are decentralized. And so, we really look at moving supply chains toward a center-led approach to services, just like they would for all other spending decisions. So, we typically see that the power lies in the end user. They're negotiating and making purchasing decisions independently. This isn't great in a health system of any size. Supply chain is the one whose core competency is negotiating and dealing with suppliers, and so they really need to partner with end users on these decisions. And that way they get a common view of their contracts and spending. That way controls can be exercised and put in place. There can be standardization on quality. One thing that often gets overlooked is CMS and their purview over services contracts and ensuring that KPIs are tracked on a routine basis and approved by all the way through to a medical executive committee on an annual basis. We like to move organizations towards a center-led approach where supply chain and end users collaborate together to ensure that categories overall are managed in a way that's most beneficial to the health system. How can we look at the decisions we've made in the past to better align us for the future? How can we bring expiration dates on contracts to be coterminous so we can standardize on particular suppliers to ensure that not only we get the best price for our institution, but perhaps even more importantly, we get the best value and quality from our supplier and make sure that trickles down all the way to our patients. We also want to bring in tools to help automate that process. Just like value analysis tools were needed to automate the process of bringing in new medical devices, you need a set of tools to help you understand your purchase services spend, collaborate with your stakeholders, and ultimately source and monitor those services contracts. And that's not things that can be repurposed. So you can't hack a value analysis tool to fit purchase services. You need something that's purposely defined to really better understand what you're doing in purchase services, make the experience seamless for your supply chain team and your end users, and ensure that you create a continuous lifecycle management process that allows you to continue to grow the program and ensure that it's maintained over a period of time. You need to have data transparency across your entire supply chain. Who are the points of contact for both suppliers, categories, and contracts? Where do contracts live? This is one where it's like it seems so basic, but many organizations have a legal system for contract management and perhaps a separate repository for supply chain, and maybe even there's contracts that don't live in either system that were negotiated with end users and never made their way back into those systems. So putting a system in place to ensure that you even know where every contract is and what your expirations are. Utilization. This is one that's notoriously difficult in services. Often services are not on purchase orders, and so we're not able to track them down to a level of detail. There are systems that are being built to better able health systems to gain an understanding of what their utilization is and find out, hey, do I really have a rate problem, or is it really that my volume is too high? Facilities access. So who's even accessing these particular services, and is it the right people? Procedural schedules on when those things occur. KPIs, are they being tracked and maintained? Accesses and permissions to those services again. So all that transparency across this continuum is really what's going to allow you to get your arms around your purchase services spend and be the basis for moving forward and improving your situation. The number 2 guiding principle for the future of purchase services spend is the role of category planning for supplier selection. So this goes back to something I talked a little bit about in the previous sections, but you really need to come up with a strategy on how you move forward in each category with your supplier base. And so you need to really get your arms around it first, which we just talked about, because you need to really understand what is the current picture. You may have had situations in the past where end users are signing up suppliers and putting contracts in place that you didn't know about. You may have supplier quality issues that you want to address. All those things come into play when it becomes time to decide how you're going to move forward. How do we get contracts to be coterminous so we can potentially standardize down to a single supplier or a smaller number of suppliers? So all those things come into mind when you start to develop these category plans. And so what does that look like? You really need to look at beginning with an outcome in mind. What are you trying to achieve? And sometimes you may need some help, from a benchmarking platform or or somebody to tell you based on the category maybe where you should go from a service level perspective. But you really need to know what are you trying to achieve before you get started. You need to get everybody's buy-in. So it's really important to, again, maybe you use somebody else with some expertise if you don't have it internally in the category, but you're able to then get the buy-in of supply chain and your end users and executive support to get everything aligned to be able to move forward. Collecting expertise. So again, this goes back to the previous point I just made. If you don't have that domain on your team, you need to figure out how you bring it in order to really elevate the supply chain team to be knowledgeable with the end users and make sure you have their trust and their buy-in. You need to create a culture of momentum. So the biggest factor we see in purchase service project failing is the fact that it fizzles out. And it fizzles out because the stakeholders aren't engaged. They haven't bought in, back to the previous point. And so building a culture of momentum and ensuring that you continue to make the steps to move forward, and potentially even, again, using a platform to help with that, really helps the purchase services program snowball and move forward. The next one is really monitoring with accountability. So oftentimes supply chain negotiation can be a black hole. It's not monitored and tracked in the same way that a sales pipeline is. But should it be? We really believe it should. We believe it should be tracked with some type of data processing to be able to tell you how does one team member perform over the other in negotiations, which methods that we take, going to a full RFP versus negotiating with an incumbent versus activating a GPO contract. What produces the best outcome for me in a certain time frame. So beginning to be able to learn those data points really allows you to merge that with a strategy and, again, come up with the best perspective to execute a category plan. Fostering open dialogue is really important. And again, so this comes from a place of trust and buy-in and momentum and knowledge. And so that way it's really clear from the start, from supply chain through to the end user, exactly what's needed for our health system. And again, that's where it's really important to say that this is not just about price. It's about tailoring a service to be the best for you in your particular situation. Being flexible. I mean, this one's just obvious, and for the most part, if you go in too close-minded, you may miss something amazing from a supplier that's right in front of you. All suppliers are trying to be very creative right now, whether that's with their service offering, whether it's with their pricing, whether it's with how they're functioning in the environment. So be open to the flexibility that these suppliers may provide, and be open to flexible, be flexible to ideas you may hear from your stakeholders on how to better engage with those suppliers. Celebrating collaborations. And again, this is one that just seems so obvious, but it's not done enough in what we see out there with our customers. So when you make major strides, between the supply chain team and your end users, celebrate those collaborations, celebrate those milestones, and that will, again, allow you to build that culture of momentum and snowball so that you can keep things moving forward. Following the data. This gets to, again, having some type of platform or basis underneath it all that allows you to know which direction to go. Right here, no action is sometimes the best option. Know if you're already good in this category. Don't spend a year doing an RFP when you're not going to get great results. Utilize that data in order to make the best decisions for each category. And then remember that suppliers are experts of their field. RFIs are great tools to learn a lot about a category. Interacting and dealing with your current suppliers and tracking and monitoring their KPIs is a great way to help you become an expert. But really tap into those supplier resources in order to best understand a particular category. So we often take each supplier and category through a dependency assessment. And so that would look something like this. Within our team and our stakeholders, is this supplier critical to my operations? What is our crisis and response continuity plan? Do we need to find a list of alternatives? Can I collaborate with other providers in my area to strengthen our response strategies, which is often done sometimes through regional GPOs, but maybe can be done even a little more. And then a 3-tiered approach to prioritizing projects to the category. So, we really view the category span or continuum in this way. You have your A categories, which is going to be a small number of categories that are high spend. This is where consultants are going to come in and place a lot of their focus, and where your executive team will be placing a lot of your focus. But you need to remember that the middle spend and category maintenance, or we call it our tail spend, that equals a similar amount, and that requires a strategy in itself. You still have the same supplier risk there. You still need to make sure that you have contracts that are not expiring and that you are properly managing that spend. And so it bears a different approach than those large categories. It bears more of a life cycle maintenance approach, like we bring up, rather than these kind of maybe singularly focused projects on big savings that kind of happen every 3 years in those big categories. So what we call our platform is something we really like to help people achieve in now what we're calling third-party services. So this is where we're calling it a lifecycle management platform for third-party services or for purchase services. So it's continuous. You need to analyze your contracts and spend. You need to benchmark those categories to see where you stand competitive to the market. That goes back to, do I want to spend time here? Do I need to spend time here? And so remember, that's not just a price benchmark, but also a service level benchmark. Then we get to the piece of, I need to figure out how I'm going to market. Am I going to use an e-negotiation tool? Am I going to do an RFP? Am I going to negotiate directly with the incumbent on the phone or in person? Or maybe I'm going to activate a GPO contract for this particular category. So all those options are on the table, but you really need to have that as a step in your process. Then comes onboarding suppliers. If you're going to make a supplier switch, you need to have a plan, and you need to be aware that there are going to be switching costs. So while you may be saving money in the long term, there may be some short-term pain within your organization in order to bring them on board. And then ultimately, you need to monitor performance. And honestly, this is something that we see being left by the wayside far too often. And suppliers really want to engage here with you. They're just not often giving you the opportunity. And so let me give a great example. We had an organization out in Colorado where they brought in a supplier for a QBR. Everyone inside the four walls of the health system knew the supplier wasn't participating well. The supplier comes into the QBR and is shown these horrendous survey scores, and they hadn't had a QBR in a year and a half. And so the supplier has no way of remedying the situation and making it better, and the health system isn't happy. So you got to have some way for suppliers and the health systems to collaborate in more real time to address issues like that. And that goes back to the core as well of the CMS requirements around tracking KPI performance of your contracts that relate to patients. So you should be tracking these metrics on a monthly or quarterly basis. This should be self-reported by suppliers and then approved by the end users. And then finally, they should be reviewed on an annual basis by a medical executive committee, to make sure that you are, up to code for CMS and JCO. And frankly, it's just a best practice for your organization. You want to make sure that your suppliers are providing the best service to your end users, your stakeholders, which ultimately will trickle down to the patient. And now we get to guiding principle number 3 for the future of purchase services, building a case for supplier resiliency. And again, this is one that's really been brought into the forefront here because of COVID. And so, much of the focus has been placed on that international and national area. So all of the questions around the sourcing of PPE and whether we should have domestic manufacturing and you need contracts with domestic manufacturers to ensure that in a time like this, you're able to get the PPE you need to supply your health system and keep your workers safe. Obviously, that's been in the news a lot. But what gets lost, it is also very important, is that you need to be able to have a resilience strategy both locally and regionally for services that are essential to your hospital. So in many cases, there's only a small number of suppliers who can service a regional area for a particular service. And so knowing who those providers are, adapting them and having them a part of your category strategy, playing in the market, maybe more frequently, either through benchmarking tools or through talking with suppliers more frequently than every 3 years, can be really important in making sure that you can handle a situation where you need to make a change. Now, how do you do that? How do you put your organization in a place where they can do that? And so, number one, understanding short and long-term goals from leadership is extremely important. Making sure that top-down everyone understands, from supply chain through to the stakeholder and users, that this is what our organization is trying to achieve, will help really the change management in a major way. And so, we talk all about governance for value analysis, and there's value analysis platforms that have been put in place to help with that process. But it's also extremely important here as it comes to purchase services. Community interest. So again, there's a big push to engage the community and make sure that the decisions that a health system is making and the suppliers they are selecting are aligned with the interests of your community. So make sure that that's kept in mind. Are you using municipality resources? Do you have local green initiatives or stringent regulations in your community? Keeping all those things in mind are extremely important. Physicians and stakeholders. Obviously, having a relationship with them, involving them in this process. We really see governance and purchase services look almost like a bunch of mini value analysis teams spun up when it's time to execute a particular category. Who are the people inside our organization that can help figure out the services that are needed and the right supplier that can tailor a package for our organization? And then also bringing in, what are the supplier goals? It's a win-win when this arrangement is beneficial for the supplier and beneficial to us. We need the supplier to maintain an ongoing concern and be happy in order to provide the best service to our health system. So how can we come up with a win-win? How can we build KPIs that will help that supplier stay in line and provide what we need for our organization and keep them motivated and incented, and also keep us having an eye on what's really needed? So it comes down to setting KPIs, and so, what are some different ways to do that? And remember, it's going to vary by category. So we've broken them out into 3 different areas. There's cost KPIs, quality KPIs, and outcomes-based KPIs. So you don't want to be pessimistic, but you need to be proactive about what could go wrong. What could impact my ability to hit my budget? What are the fluctuating expenses in this category? For instance, in food and nutrition, if you have a per patient day rate, but when you have expenses like floor stocks or catering that can fluctuate by day, who's monitoring those? Who's signing off on catering? I've seen some organizations have different tiers that would require different levels of sign-off on who ordered the food and what type and those different types of things. So it's important to keep those things in mind so that you don't get hit with an unexpected bill from a supplier. It's important to ask these types of critical questions across your categories. And it's really important that you have an alignment on the KPIs all the way to your end users, because they're really the ones who should be looking at these and approving them on a monthly basis. It's supply chain who should be helping to put the process in place, but empower and enable your stakeholder and end user to be an active participant in this process. Lastly, for this guiding principle, you need to really employ multiple sourcing strategies. It is not a one-size-fits-all exercise. There are multiple ways to win, and it's really about spending your time where you get the best return. So again, do you use benchmarking tools to tell you how much meat there is on the bone in a particular category based on the contract you currently have in place? And so do you use discussions with your current supplier and your stakeholders to determine the best strategy to use? So you don't always have to go to RFP to get savings. Oftentimes incumbents will be happy to avoid an RFP and just negotiate with you directly. Save time and avoid switching costs because we really like the services the supplier is providing, but we need a better price for our organization. And how do we get there together? Co-terminus contract alignment. So again, that's another area where you can get win-wins. So do we have a situation where, as time has gone on, we've built up 10 suppliers in the category when there should really only be 3. And now all the contract expirations happen over the next 5 years. Well, let's again find some win-win for the supplier and for us as we start our category strategy. Let's trade some short-term savings from the supplier for a lengthening term in order to ultimately get all the expirations to sync up at the furthest and give us the ability to do a RFP at that point that will allow for even bigger savings and for standardization and for our goals. So again, finding those alignment opportunities. Auto renewal can have its time and place. And then finally, do we go into a live negotiation? And this is something that at Conductive we have seen be really successful in helping to push suppliers to, not only give you the best pricing, but to really make sure you get the best service levels, the best in class service levels for your organization. Now we get to the fourth and final guiding principle for the future of purchase services, which is balancing savings with total contract value. And so again, this is something that's going to be increasingly important coming out of COVID. We're all going to be looking for how do we save the most money possible? Because we lost all this revenue, elective procedures went away for a certain period of time, the demand will come back, we will get that revenue, but it's all pushed out into the future. So how do we address this financial gap? And again, purchase services is a great way to do that. But, how do we do that at a balance of price and value? We can't sacrifice what we deliver to our patients. We can't sacrifice how we enable our stakeholders and end users. So we need to find a way to drive the maximum value from these contracts. So, our biggest caution is don't sacrifice total supplier value for price. Beyond price, there are so many factors you can optimize and you can look at. And again, when you use a live negotiation and when a supplier is out of room on price, there is still additional things they can offer you to improve the way they work with your organization. They can potentially improve turnaround times, or they can potentially reduce, contract labor versus on-site labor. Whatever it might be, there's a way to do that. So, how can you support your purchase services program and build positive outcomes across your organization? And again, suppliers being excellent and getting great reviews from both your stakeholders, end users, and your patients is the way that you're going to do that. So with that, how do we build momentum and reflect on what's happening? How do we protect lives, stimulate our local economy, improve population health, and continue that repeating over and over and over? So what we like to do is have a checklist for creating a purchase services program. So first, we need to establish that advocacy team with executive support. So again, that gets back to these spinning up these individual advocacy teams, as we call them, or individual value analysis teams for a particular category. And how do we ensure that we make sure that it's top down? This has come from leadership. They're leading us towards this goal, and now as supply chain, we execute and bring our stakeholder along the way. We need to identify priorities and list key objectives. We need to set that governance process to measure and report on key performance indicators, so that way we can keep this program moving. We need to make sure that our leadership, stakeholders, and supply chain are all bought into a project plan where we can track the savings by category, facility, and supplier. We need to centralize our contracts and insights. We can't know where to go if we're looking in the dark. So we really need to bring all that into one place so we can make intelligent decisions together. Once it's there, how do I tell how competitive my current contracts are? What are some services like Conductive that I can use that will tell me, do I have the right service levels? Do I have a competitive price? What would be the right strategy to move forward? When we do our benchmarks, it's really much more than a benchmark. It's more like a home appraisal. We're going to read through every line of that contract. We're going to tell you what's wrong with your invoices and better ways to have your suppliers invoice you moving forward. We're going to tell you a strategy of how to go get the price that we tell you is available in that category. So it's much more than just a benchmark, but it starts with the benchmark. We then need to build in a sourcing strategy that includes multiple methods. So again, let's look back to, do we need an RFP here? Is this worth 6 months of our time? And lastly, we need to secure resources to manage program performance. We can't do this in email. We can't do this in a spreadsheet. We need a platform that's purpose-built for purchase services, third-party service management. And again, that's what Conductive does. And there's others out there as well, but we really recommend that you build your program, your governance up from that really strong basis. Because when you have that foundation, the credibility with the stakeholders, your ability to execute, and the speed at which you can execute are greatly enhanced. So with that, just a little bit about us and what we really want to help people achieve. We want to help you analyze your current situation. We want to use analytics and our categorization to help you get your arms around your purchase services spend. We want to help you learn, so that way you can be experts in front of your stakeholders. We want to provide material to make sure that you understand each category when you get to the table with your stakeholders and end users. We want to help you benchmark. So again, across multiple categories by key service metric, we want to show you where the opportunities lie. Not just at the category level, not just at the supplier level, but even down at each line item and each term in your specific contracts. We want to help you source contracts, figure out the best way to get them, and I'll get into that in a minute. But is that you doing it on your own directly with supplier? Is it using a GPO contract? Is it negotiating with an incumbent? Whatever it is, we want to help you with that. And then we want you to be able to monitor and report. So again, that SLA tracking that's really needed for CMS, ensuring that payments match what the suppliers are doing, and the verification of service is where we want to go. And then ultimately, bringing those reports out, bringing those insights out to the rest of your organization so they can really see how this program is building and can enable you to get the momentum to keep moving forward. So, we really look at that. We're illuminating contract opportunities for you for purchase services. We have what we call express contracting, which is now a purpose-built portfolio of local and regional agreements to ensure that you can quickly work with purchase services suppliers and have those ready-made best-in-class service level terms and pricing ready to go. And so that's something that's really not been done in purchase services much historically, and this is something that we just brought to market back in July. We want to help you with category management. So we want to help you figure out how you align those contracts to ensure that you can make the best decision for your organization. So we're going to churn through your data to build that roadmap that you can then take the leadership to say, this is how, and your stakeholders to say, this is how we're going to get success in this category. Spend optimization. We want to make sure that, again, you're spending money in the right place to get an ROI for your organization. And then finally, we're going to help you establish those business processes, right? We're going to give you access to category experts and best practices, whether that's through materials or through the people on our team who've been looking at purchase services for 15 years. We really appreciate the opportunity to speak to you here virtually. We wish it was in person, but we hope you enjoyed the session today. We'd love your feedback on what you thought about this session, what you liked and didn't like. And hopefully soon things can return to normal. We can't wait to see you in person again. Thank you very much for the time, and everyone have a great day.